We need to take a moment to focus on the grave issue plaguing our nation, especially in the heart of Kensington, Philadelphia. It's impossible to ignore the urgent public health crisis at hand. Imagine a neighborhood once vibrant and now marred by the presence of an enormous open-air drug market. In these very streets, we see a distressing scene. Countless individuals, their lives derailed by addiction, openly using drugs that heroin and opioid pills. And if that weren't grime enough, enter xylazine, a veterinary tranquilizer, further exacerbating this crisis. What's truly alarming about xylazine is its potent combination with fentanyl, a synthetic opioid that's frighteningly more potent than heroin. They've nicknamed it Tranq on the streets. This concoction wreaks havoc on the users, causing necrotic ulcers that reach down to the bone due to restricted blood flow in the skin tissue. It's a devastating sight, and sadly, it's become all too common. Statistics paint a harrowing picture. A staggering 90% of street opioid samples in our city contain xylazine. Even more alarming is the fact that 44% of accidental fentanyl-related overdose deaths involve this deadly tranquilizer. In 2022, there were more than 1,400 deaths due to xylazine's overdoses. Treating these ulcers is an uphill battle. Xylazine's impact on blood vessels, coupled with dehydration and unsanitary living conditions, complicates the healing process. It's a dire situation, further worsened by the sedative nature of xylazine. Unlike regular narcotics, it doesn't respond well to naloxone, the typical antidote. The resistance has led to a spike in fatal overdoses, rendering our efforts to save lives all the more challenging. In confronting this crisis, we must acknowledge the urgency of this situation and work collectively towards solutions. It's a call for compassion, education, and above all, action.